many variables that a hospital needs to consider in layout design are medical supply centers, breaking rooms, elevators, nurse efficiency, beds for patients and their family members, environment and aesthetics, working flow, illumination, equipment setup, services supplies like water, gas, electricity, etc., optimum spaces, including, of course, the height of the roofs, different environment setups according to the type of patients, like the neonatal rooms, budget, capacity, waiting time, patient's health, etc., among others. The advantage of the circular pod designs are that it minimizes the number of trips and distance covered by the staff. It has the attributes of a work cell, so it reorganizes people and facilities into small groups, providing a single service, and the staff is in closer proximity to the patient. It has computerized medical records, stations, and elevators used for food delivery service. Also, new style of neonatal rooms. The hospital circular spot design provides a maximally efficient layout in all areas in the hospital, creating a patient-centered environment. With the nursing station in the center of 10 or 12 bed circular pods, no patient room is more than 15 feet from a station. The time serving are in the 20% range, which is critical since the nurse efficiency is very important because of the shortage and high cost of healthcare professionals. Hospitals in my area have the basic rectangular layout, unlike Arnold Palmer, which has the circular pod design. Staff isn't like a work cell and distance are far. It can be noted that the efficiency in their process isn't at the level of Arnold Palmer's hospital because it doesn't have the same advantage like shorter times, closer proximity to patients, and healing environment. The Instituto Mexicano del Seguro Social, in its General Hospital Number 1 in Querétaro, has a traditional hospital layout or racetrack design, which means that the rooms are in two linear hallway with exterior windows. Supply rooms are on the interior corridors and nurses stations in one side. If we compare the layout with Arnold Palmer, we can easily realize that it's not as efficient as the circular pod design because of the lack of efficiency the nurses have in their workflow and the distribution of the rooms. Most likely, some new hospitals will duplicate Arnold Palmer hospital layout because of its proven optimization of space, working flows, and resources. Servicescapes describes the humanistic effect physical surrounding can have on customers. Therefore, it is important at Arnold Palmer Hospital because it has a great amount of influence in the patient's condition. It is highly used in their layout, for example, in rooms. It provides patients with a serene environment with warm colors, private rooms with beds for their family members, for team food selling, and oversized windows that provides natural light. Another example is the baby intensive care unit that is accurately designed to all the baby's needs. It includes family-centered care, reduced noise and light, and added roofing floors, acoustical panels, and privacy curtains. Also, servicescapes refers to the environment in which services are delivered and where the firm and customer interacts. It is very important at Arnold Palmer's Hospital because according to some studies, patients who are in a comfortable environment have a faster and better recovery than those who are not. A good example is in the neonatal area. They found that with the new design, babies need to stay for a less time in the hospital since they get healthier faster.